Hello and welcome to Bytes of Health, where we hope to take a bite out of your parent worries each day with sound advice and guidance. Every morning, we'll answer a commonly asked pediatric question in 5 minutes or less. I'm Dr. Jess Steier, a public health scientist, and today I'm joined by our amazing pediatrician bestie, Dr. Dina DiMaggio. Hello, Dina.
Hi, Jess.
All right. Well, today we are going to talk about when it is safe for a child to return to school after being sick. The clock is ticking, so let's get to it. All right, Dina. So I know we're going to break down different scenarios about, when it's safe for a child to return to school. So let's start with, what about when my child has a fever?
So that's the most common thing we see. So when your child just has a routine viral illness with a fever, she can return to school when the temperature is under 101 for 24 hours without the use of a fever reducer.
All right. What about when my child has the flu?
We are seeing a lot of that right now. So the same rule applies here, basically. So when she's feeling better, when the temperature is under 101 for 24 hours without the use of a fever reducer, they can return to school.
Okay. What about when my child's tummy is upset and he or she has diarrhea?
So basically what we say is when stools can be contained in a diaper, or if when toilet-trained kids have no accidents and stool frequency is back to normal, meaning they are not having more than 2 stools above their normal in 24 hours, they are free to go back to school.
All right. What about ear infection?
So as long as your child has no fever for 24 hours and the pain is under control, she's okay to remain in school because ear infections aren't contagious. What often happens is the child has some kind of viral infection, gets congested, and then clogs up the ear, and that's what the ear infection brews. So the ear infection itself can't be transmitted. It's just more of the virus that causes it.
And I'm seeing a real theme here with the fever. That's a big indicator, right?
Yeah. So don't pump your child up with Motrin and then pretend they're fever free,
right,
and then send them back to school. It has to be without the fever reducer is the big theme too.
All right. What about bacterial conjunctivitis?
The dreaded pink eye. So most daycares will require 24 hours of treatment if your child has bacterial conjunctivitis with antibiotic eye drops before returning. And obviously they can't be all goopy and before returning.
Lovely. Okay. Hand, foot, and mouth.
So a child can't return to activities until, again, they have no fever for 24 hours or fever reducers. They're feeling well enough to fully participate in their school activities. They're not drooling more than normal. And the teacher feels the child is not too sick to be in class. And it doesn't affect the care of other children. And the blisters should be drying up and crusting over and resolving.
Okay. What about strep throat?
Yeah. So according to the new policy from the American Academy of Pediatrics, children with strep throat from group A strep should not return to school or daycare until they are well appearing, again, have had no fever for 24 hours. And once they've had 2 doses, of course, of an appropriate antibiotic, 12 hours apart without fever.
Interesting. So it's 2 doses of a course of antibiotic. That's good to know.
Correct.
All right. What about COVID?
So nothing has changed, despite, parents are still very frustrated. But according to the latest CDC guidelines, people who are infected but asymptomatic or people with mild COVID-19 should isolate through at least day 5. So that means we stay home. Day 0 is the day symptoms appeared or the date the specimen was collected for the positive test for people who are asymptomatic. And they should have no fever for 24 hours before coming out of isolation. But however, they should also still wear a mask through the 10 days. So isolate for 5 days. And if you're feeling better without a fever, you can go out, but you need to wear a mask for an additional 5 days.
All right. Well, I learned something. We hope you learned something. And we have lots more to share. You can get your bite of health every day, Monday through Friday. If you like what you've heard here, let us know. Leave us a review on Apple and be sure to tell your friends. Remember, there is no single or best way to parent. Parenting is a journey, and we are all just doing our very best. We wish you happy, healthy, and stress-free parenting.